link, and there will be a link to view this session that will be made available. And during the session, your videos will be turned off during the presentation. And please keep your mute button on during the session. And use your chat box to ask any questions throughout the presentation. There will be a Q&A time. So I want to say miigwech for joining us for this AICHO session in Indigenous Response to HIV/AIDS with Sharon Day, the Executive Director of Indigenous Peoples Task Force. This presentation is possible because of funding support from our partner, St. Louis County Public Health. Leanne, I'll just introduce myself. I'm Leanne Littlewolf. I use she, her pronouns, and ma'inga nindu deim idash gazaga squajime cog unchiba. I belong with the Wolf Clan, and I'm a tribal citizen of Leech Lake Nation, and I am the AICHO co-executive director. And I work and live here in Onigimasing, also known as Duluth, which is the ancestral, traditional, and contemporary lands of the Anishinaabe, Dakota, Northern Cheyenne, and other Indigenous nations. So please feel free to introduce yourself in the chat box and also share which Indigenous lands you live on. I'd also like to share a little bit about the American Indian Community Housing Organization, AICHO, who is hosting this event. AICHO is an Indigenous-led, people-first nonprofit organization. We provide culturally specific domestic violence emergency shelter and legal advocacy, supportive and affordable housing, cultural and community programming, Indigenous arts programming, children and youth programming, food sovereignty, movement building, and social enterprises to build Indigenous economy. All of our work is anchored in our mission to honor the resiliency of Indigenous people by strengthening our communities and centering our Indigenous values in all aspects of our work. Tonight's presentation is second in a series of 3 virtual Indigenous health-focused webinars that AICHO is leading in partnership with St. Louis County Public Health. The third event is going to be on next Wednesday night, which is October 19th. It will be Francis Sacco and Frank Goodwin, who will present on Indigenous cultural and community response to mental health and well-being. These sessions are free and open to the public. Registration is required, and to find out more, go to AICHO's website at www.aicho.org. And so tonight, I'm just really grateful to be here with all of you and to learn alongside of you from Sharon Day. I remember going to Cass Lake Powell in 1996 and seeing the Indigenous Peoples Task Force table there and meeting the outreach worker who spent a lot of time speaking with the youth group that I had was working with and talking really candidly about HIV and AIDS in our community and handing out really good information and resources. I have a tremendous amount of respect for Sharon's work, her commitment, and her creative approach. And I want to share a little bit about Sharon. Sharon Day is an Ojibwe leader, Native American activist, artist, and writer from Minnesota. She is an enrolled member of the Bois Forte Band of Ojibwe, and she has received numerous awards, including the Resourceful Woman Award, the Gisela Napka Award, the BIHA's Women of Color Award, the National Native American AIDS Prevention Resource Center's Red Ribbon Award, the Alston Bannership Sabbatical Award, and the Spirit Aligned Leadership Fellowship. The governor of the state of Minnesota and the mayors of both St. Paul and Minneapolis named November 10th, 1998 after her, Sharon M. Day. So I just want to do a warm welcome to Sharon, who's going to share some really good insights and help us learn more about HIV and AIDS and Indigenous community and a response. So I'll hand it to Sharon. Miigwech.
Yeah, I'm really happy to be here this evening, and I don't feel like I need to say anything more about myself. Leanne did a really good job there. So tonight I'm coming to you from Center City, Minnesota, which is where I live on a farm with some goats and chickens and some dogs. And Center City is located near Taylor's Falls, between Taylor's Falls and Forte Lake. So so definitely on Dakota land, and it's such beautiful land. I I can see why they loved it so much. So I'm going to go right into the presentation. And I have to say just a little disclaimer. All of our HIV staff currently are in Puerto Rico and at a national HIV conference. So I was pretty much left to my own devices. But this was a PowerPoint that I had prepared about a year ago for a national foundation. They wanted me to speak about HIV and the Native community. And so I wanted to talk about it from a particular standpoint. And because, HIV, like everything else, doesn't happen in a vacuum. So I'm going to go ahead and pull up my PowerPoint here. When I developed this, I wanted to talk about it, about HIV and a little bit about Hep C and also COVID, because all these things are related. And I want to talk about it as a public health crisis as a result of racism. So first, just a little bit about the task force. We started off in 1987 as the Minnesota American Indian AIDS Task Force, and it was a group of about 12 of us who got together because two individuals came to me that year, and I was working for the state of Minnesota at the time in the Chemical Dependency Program Division, and a woman named Carol LaFavor and my younger brother Michael both came to me and said they had an AIDS diagnosis. And in those days, there were no medications. If you had AIDS, it was really a death sentence. And so Carol, I'd actually done her intervention a few years before that, and she contracted AIDS. She came to me and she said, I have AIDS, and what are you going to do about it? And so I got a committee together, and we did some community forums, and I hired a young woman to put together a curriculum. And so that's how we began as a volunteer organization. And we started off with outreach and case management, and then in around 1992, one of our case managers came to me and said, I want you to see one of our clients' houses. And so she took me over on 11th Street in South Minneapolis, and Jackie, her name was Jackie. She lived in this duplex, and the duplex, the back door was nailed shut. She couldn't open the back door, and the basement was filled with old refrigerators, and the landlord used the basement just kind of as a dumping ground of old stoves, refrigerators, that kind of thing. And at that time, the housing shortage in Minneapolis, the vacancy rate for apartment rentals was about 2%. And so we decided to build housing. And so we built a housing complex, Manitowoc Kodana, which we still operate today, and beautiful units. We worked with an Indian architect, Douglas Cardinal. He was the architect of that designed the concept of it. And at the time, he was working on he was also the architect of record for designing the National Indian Museum in Washington, D.C. So at that time, he was working on like a $50 million project. And I approached him and said, I need you to help me with this housing. And I gave him some sweetgrass that I'd picked with the Miigwechs up in Canada, and he was Canadian. And I handed it to him and I said, I need you to help me. And he said, why me? And I said, because I read that you had said if it weren't for Indigenous healing, you wouldn't be alive today. And so he said, okay. And so then he got, there was about community people living with HIV, people who were elders, and we all got together and we created the vision for Manaduwada Kodena, place where ceremonies happen. And it's a beautiful facility, cedar siding. The property is lined with cedar trees, and there's a little garden in the center. So we've been, let me see, I didn't want to do that yet. So we've been doing, you know, all of these prevention, testing and counseling, you know, harm reduction, case management, all the way up through housing, this whole continuum of care for many years. And this year we're adding STI testing to our scope of services. And we're one of two programs that are directly funded by the CDC. We also have funds from state of Minnesota and Hennepin County and some other NASDAQ, which is a National Association of State and Territorial Directors. So we've been doing this since 1987. We have seen many things change over that time. In the beginning, there were many people in our community, Native Americans, Native American people who were alienated from their families. Back in the 80s and 90s, the population that was most affected, where transmission occurred, was among men who have sex with men. But we also, our first two clients were also lesbians. So not to get the idea that it was only men, and men who have sex with men who were getting contracting HIV. So we saw so many of our people die in those first few years, and many times they were alienated from their families because they were queer, or because they were IV drug user, and so many times we were the only people with them, and some of that's changed, but not completely. And I'm just going to go on now. But you know, HIV doesn't happen in a vacuum. There are all these other things that happen because HIV is not an easy illness to contract. You have to do something to get it. Different than COVID, where you just have to breathe the air. But to get HIV, you have to have sex with somebody, unprotected sex with somebody who's positive, through needle, sharing a dirty needle with somebody who's infected. And basically those are the two ways that you can contract it. So, you know, in terms of what's happened to our people, you know, we can go back to 1862 when the Dakota people were removed from Minnesota after the 1862 uprising. And, you know, there was a law that said that they were going to be removed from the state of Minnesota. I believe that law is still on the books right now. So, you know, these people were kept in internment camp at Fort Snelling, and many people died during that winter. The rest of the people were sent on barges down to Davenport, Iowa. Of course, they stopped at Mankato, and the 38 were hung there, and the rest of the people were sent down to Davenport. and then up the Missouri River to Crow Creek. In 2017, I walked the Missouri River with 5 other women, and one of the women was a Dakota woman whose great grandmother, Stanza Stone, was one of those young people that was on that barge that went to Crow Creek. And so we think about history, sometimes 1862, like that was a while ago, and yet this was her great grandmother. And so when you can go look at your history that way, uh, it's not that far back. In other ways that we could spring forward now to 100 years, and in the year that I was born, 1951, they decided to relocate us to cities across the country. And this picture is a picture of my mom, my dad, and my brother Stan, and some of my sisters are in this picture. And I'm the farthest to the left, scratching the back of my head, which I still do today when I'm nervous. And they moved us to Cleveland around 1960, and I think I was about 12 years old there. And we stayed about I'm not sure, maybe 6 weeks, not longer than 2 months though. We went out there on the train, and when we came back on the bus. We stayed long enough for my dad to make enough money for us to come home. But relocation was just another, mechanism to remove us from our lands, and um, and the most of us, especially the Ojibwe, we were told in our prophecies to have little contact um, with um, and the folks that came, the settlers, colonizers that were coming. We were told to have a little contact with them, and so that's why we moved to west, and and um, and so we did until World War One, World War Two, and the Korean conflict. And after that, of course, Native men and women joined the military to protect the United States and to protect a way of life, and then did not go back to the reservations. But this moving off the reservation, the people who were veterans did not get access to GI Bill and things like that. They were referred to the Bureau of Indian Affairs. So it's just another way that racism has been very different in this country when you look at how it has played out among African American people and among Native American people, and the Asian Pacific Islanders and Latinx folks. With the African American people, racism took was forced segregation. And among for Native American people, it was forced integration by the boarding schools, the mission schools, and the relocation, moving us from what was left of our homelands into the city. Okay, now here we go. And so here we are now, 2019, and some of you may have heard about the Wall of Forgotten Natives. This was right like 2 blocks from my office, and there were sometimes some estimates for like 500 people were camped here, um, and are people still living in poverty, still, feeling the effects of unemployment and underemployment and all of those things. And I remember back in the 70s, there was a woman, Laura Woodstock, who did a survey, kind of a study, where they went and they interviewed uh, indigenous men mostly, who uh, were living in St. Paul, and they were mostly chronic alcoholics. And so when they interviewed them, they asked them a number of questions. And one of the things that these people, and they asked them, um, why did they drink? Why did they all hang together in these groups that were living on the streets and all crowded in one apartment? And they said, because we only want to be with Native people. Like, we want to sing our songs, we want to eat our foods. And I think, when you see the Wall of Forgotten Natives, you see some of the encampments today, I believe that's still, if you ask them, that's what they would say. We want to be with Native people. Uh, and things are very different today than they were even in the 70s. And we're still feeling the effects of, hundreds of years of racism. So then you add COVID to the picture, and we know that our people died at a higher rate, and um, some of that had to do with already having other illnesses, diabetes, heart disease, um, um, where already had underlying conditions, comorbidity, and um, so we've lost so many people, and um, and then you add that to the things we're already dealing with among the HIV population, among the unsheltered population, um, and um, it was just a disaster, and still is. So not only did we die from COVID, but we died from other kinds of illnesses, preventable deaths, just due to lack of services. Because if you remember, in the height of COVID, you couldn't go, it was hard to see a doctor. Those of us who could see a doctor, sometimes it was through telehealth, but that meant you had to have a computer, right? So there were also a number of, we began to see the overdose surges, and the there were so many calls in the East Phillip neighborhood, more than any other community in Minneapolis. And then George Floyd happened, and that had a big effect in South Minneapolis. I mean, around the country, and around the world, really. But George Floyd, it really shone a light as to the reality of racism that we're still continuing to deal with today, and we know that there are so many of our relatives who are also the victims of police violence, and when we think about not only the police violence, but then the violence that we deal with day in and day out, missing and murdered Indian women, missing and murdered people. We walked the Red River I think it was 3 years ago, and we carried, the names of all of the indigenous people they pulled out of the Red River since 19. We went back to 1976. That was where we had access to records from, and I think there was 124 names of women and indigenous people that were pulled out of the Red River. And we created a staff and we carried that with us. And, it was interesting when we got to across the border in Canada. The Canadians were really greeted us very warmly and wanted to know what we were doing. And they wanted to know about the staff with those names on it. And so we told them, and they said, at least two people said, "Oh, most of those people you must have found out in the States, right?" And said, "Actually, no. We have, this country. We have such a reputation for being violent, and we are violent. But the majority, 90% of the names of those individuals were pulled out of the river in that 90 miles between the border and Lake Winnipeg. And, it's hard to kind of reconcile, people were so friendly to us and yet something that society, since 1976, something allowed them to, to murder so many indigenous women. We had a beautiful ceremony. The Miigwech relatives met us at the forts, and we had a beautiful ceremony there. Why is it not? Okay, here we go. I want to put this slide up because Dante Wright was a young man who was pulled over in Brooklyn Center for a traffic in violation, no tabs on his car, and he was shot by a police officer, a woman police officer, who she said she mistook her taser for her gun, and she shot and killed him. And I was in my car when they carried his funeral. It was on the radio, and that made me so sad. And and I just remember like driving, all during the funeral and just weeping, for this young man who died for no good reason. And I think, weeping also for all of our young people who died, and all this is as a result of racism. One good thing though with Dante was they passed a law that said that they cannot stop people for traffic violations anymore. So 2020, Angela Conley was elected to the Hennepin County Board of Commissioners. And one of the first things she did was introduced a resolution that said racism is a public health crisis. And since then, probably, I think 11 other states have also passed the same declaration that racism is a public health crisis, and it is. And I'm not going to read all of these to you, but we know these disparities, beginning from birth, have lifelong impacts on our health over the course of our lifetime, and it plays itself all these different ways. But I think, when we name something, um, and naming racism as a systemic cause to disparities is key to moving our work forward. I told you in the beginning when we started the task force, so many of the young people who died back in those years, some of them were some of our brightest and most creative people, and that didn't stop them from being alienated from their families. And things have changed, and today, love is the law. Um, and but our people, and are those of us who are queer, we still deal with these kinds of effects that that are another thing besides racism. So, and of course, how it plays itself out is, again, um, you know, we have so many people who are unsheltered, and our community, we don't have the capacity to meet um, the needs of the individuals and families across the state. And I've always admired, the work that AICHO has done in this area of creating housing, and such a beautiful facility there in Duluth. But we continue to see this right now. We have, if you drive down Cedar Avenue, there are tents there. Still today, we still, after we, the big wall of forgotten natives, you would think, that would have caused some, it's sort of like some of my and people who work with other leaders in the community say it's like playing whack-a-mole. There's an encampment here, and then the city comes and shuts it down, and they move over here, and it just continues. But we haven't done what we need to do to create a shelter for people, and everybody deserves shelter. And it's a damn shame that here in this land, the United States of America, that any of our people are without shelter. This was in the spring of 2021. This is the land that's adjacent to where our current housing program is, and this is where we'll put up our new community center. But you can see here, I think there was probably about 60 tents in there at one time. So talking about HIV, so over the years, like I said, we've been in business for a long time, and we did a pretty good job of doing prevention. Back in the beginning, Leanne was saying about seeing somebody at a powwow. We used to go to powwows. We used to distribute condoms. We used to do counseling and testing, and today, some of our reservations, they don't want us to do that anymore. And we used to be able to do a pretty good job of educating the intravenous drug using community that, that's one of the most effective ways of transmitting HIV or Hep C, and is through sharing needles, because you're directly sharing blood to blood, right? And so we did a pretty good job. Hold on just a second. I'm going to be right back. Sorry, that was my dog barking, said come in and out, in and out. Anyhow, we did a fairly good job educating the HIV population. But once you have, but once the opioids came into the picture, there was a whole new ball game, and that is because, like a heroin user might only have to inject themselves maybe once, twice a day to keep themselves from getting sick, from going into withdrawals. Uh, and so the medical community really should take a large responsibility for this, because they started prescribing oxycodone as a pain medication for many things, and over prescribing it, and it's a pain medication that's highly addictive. And so and when it became, it's also very cheap, so people started using oxycodone and then fentanyl. And the difference between heroin, like you said, if you're a heroin addict, um, 2 injections a day keeps you from going into withdrawals. But fentanyl is fast acting. It is it 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 you get uh, an immediate reaction, and it also is short lived. So somebody who's hooked on fentanyl, um, might inject themselves 10, 20 times a day. And you also do not know what you're getting. And so once this began to spread through the encampments, um, and then you had the predators and so on and so on, and it just caused this outbreak in not only Hennepin and Ramsey County, but also St. Louis County. And so this is just an image of one of the encampments that was this winter. That was over on 26th and Bloomington. And this was precisely a Native women's encampment. And it was fenced and protected by American Indian Movement. Oh, let's see. Did I give a? I think I missed one here. I had a. Okay, well, I had some figures in there someplace on what the current statistics are, but I'll just tell you what they are. I think there was right now, it used to be like in Minnesota, we were sort of a low incident state, and we might have had, maybe 11 cases a year. And I think right now in Hennepin County, there's probably like 126 cases reported, and Ramsey County about 26, and I think pretty much the same in St. Louis County, which is probably mostly around the Duluth area. So what to do? We need to have effective treatment for opioid addiction. We need to do more harm reduction. So last year at the task force, we distributed 124,000, almost 124, 592 needles, and we recovered 55,938. So how it works is somebody brings their used needles to us at a certain time, and we give them clean needles. So they're not using dirty needles. They don't have to share with other people. And then also when they come, we also talk to them about medical MAT services, which is, getting them connected with Suboxone, which will help them to not go through withdrawals for people who want to stop using. And if they can get on the MAT services and keep sort of on an even keel, that gives us time to try to get them into a treatment program. Because as you know, if somebody wants to go to treatment, chances are they can't go that day. You have to do an assessment, although there's some places that accept you without it. And then your treatment bed might, whether it's outpatient or inpatient, it might be a month out. And so how do we keep people, steady and even until they can get into treatment? And it is really hard to do anything all by yourself. I've been in recovery for 40, I don't know, 46, 47 years. But I didn't do it by myself. And, I was young. I was only 21 when I went to treatment. And, but I went to AA meetings every Friday night. And I went every Friday night because that was the night that I normally would go out and drink. So to do something else. And so it's really hard to do it on your own. And so we try to get people into treatment so that they can learn some new coping skills, and they can get some support, um, have time to find housing, and so on. We need to have low barrier housing for unsheltered. So many people who are unsheltered do not want to go to a shelter because once you sign in for the night, you can't leave to go smoke a cigarette. You can't leave to go use. If you leave, then you're out again. And so those are those difficulties. I think um, everybody has a right to shelter. And, uh, and who are we to say what that shelter should be like? I myself think that if we could build some more tiny houses, where there was a central kitchen, a central place to do laundry, um, to have food, and some place where they could get some assistance if they needed it. They fall and you cut yourself. That maybe there's a nurse there during the day where you could get some of those uh, medical issues taken care of instead of going to emergency care, where of course that costs all of us much more money. But we should, we, those of us who are sheltered, we get to choose, what that shelter looks like, what kind of house, we choose to live in, what kind of, if it's communal housing, I share my house um, with a young woman who's, a student, and she pays rent and helps me with all animals on the farm. And when she gets her doctorate, I'll look for another student, or maybe one of my grandkids will want to live with me. But we get to choose, what kind of housing situation we live in. And yet, for people who are unsheltered, they're just like at the mercy of whatever's available. And many times they choose not to go into those programs that are very restrictive. Narcan services. This is another one of our programs. And in 2021, we distributed 200 vials. Um, and um, and we probably saved some lives there. And that's what it's about. Harm reduction. Many people, you know, they go from, are all, for it, against it. I hear other community leaders saying harm reduction is not reducing harm. Well, I think we're saving lives though. And that's what we need to do until people are ready to do something else. Um, prep medication, needs to be more easily available. Right now, if somebody needs prep, we refer them to Native American Community Clinic, and for MAT services, we also refer people to Coop Community University Health Clinic, which is just a couple block over from us. Also do PEP medication referrals, and it's an ongoing issue for us to try to reduce stigma, because there is still stigma attached to HIV, um, and also to IV drug use. And I would dare say that in the Native American community, there's not a family that is not affected by this current opioid crisis. And one of the things that we're doing is we did a pilot program this spring where we took young people that were 18 to 24 years old. We brought them in for a 2-week um, boot camp, sort of. And during that 2 weeks, we gave them training around how to be a peer recovery coach, how to be a peer recovery navigator. And we taught them job skills, and then we paid them to serve 2-month internships in organizations around the community. And we just received a grant. It took forever, but we got a grant from the Department of Human Services to do 3 more of these boot camps. And out of the interns that we worked with, we hired 3 of them. One of them is a housing navigator right now. She came from another organization before that. She's a housing navigator. One is kind of a stage manager, youth worker. And let's see, there was one more. Gosh, I can't remember where he's working right now, but we have, out of the 3 that we took as interns, we hired 3 of them full time. And so it was a really good pilot program, and we hope to continue that. So these are just some statistics I pulled from a report for our CDC grant. You know, we conducted 502 HIV tests last year, and we identified 8 new HIV infections. And we found 4 people who were previously diagnosed but out of care. And we had 201 Hep C tests. And so anyhow, you can see these numbers. These are just, things that we report to the CDC. And 75% of all the people we tested are from our target population, which is the Native American community. Here. So other services we provide, health benefits navigation and enrollment, risk reduction interventions, 462. We refer people to behavioral health, all those things you can see. And the other thing that we started this year was we have 2 seniors, 2 elders, who both have a background in chemical dependency. They've run programs, they've worked as counselors. We move them into our housing complex, and they're sort of like anchor tenants. And they're available, they're taking care of the medicine garden, they're preparing medicines for people. And every Friday afternoon during syringe exchange from 1 to 4, we put up a little pop-up tent and a table outside. And so on Fridays, we provide food to anybody who comes to the door. And when they come to the door, we give them whatever the staff decide who's going to cook, who's responsible for cooking that day, what they're going to feed them. And so it can be everything from, I think last week they had macaroni and cheese and green beans, but they've also done BLTs and hamburgers on the grill and wild rice soup, chili, whatever staff cooks is what they do. But we have a fire outside, and we have medicines, same sage and cedar, and somebody's sitting by that fire, and the grandmas sit out there, and they greet people, and and they know a lot of these people, so they say, come on, Buju, come on over and talk to me, and they talk to them about what's happening with them, and we we feel like if we have that fire there and that tobacco, so many, for so long in our community, we tell people, you have to be clean for 4 days to come to ceremony. And yet the people who need it the most then are not able to be there, to be near that fire, near those medicines or the drum. And so we believe that if we can give them an opportunity to have a bite to eat, to put that tobacco in the fire if they so choose, maybe that will spark something in them. So with the elders and with the youth that we're training to be peer recovery navigators and coaches, I do believe that, we have to have a movement to get our people healthy again. And that movement's got to be led by the young people, by our young people, that there's got to be a better way. I started a theater group 32 years ago to create stories around AIDS as a prevention mechanism. And over the years, that theater group, new kids come all the time. And sometimes it's teen pregnancy prevention. Sometimes it's, we just did a play 2 years ago during COVID on suicide prevention and bullying. So we're going to create a play right now on opioid issues around opioid. So we're just putting this together, but I think these young people that we work with, we give them our time and attention. And some of the kids that we work with in the theater, they come from homes where the parents, are using drugs. Some of them live with their grandparents because their parents have been using drugs. And so we just try to give them a place where they can use their creativity, where they can know that there are people who love and care about them. And occasionally, we do something really well, and we get to go to the Kennedy Center. So anyhow, we're going to be in Duluth during MEA. We're going to do a short piece there at the closing for the Minnesota Prevention Research Center, the statewide conference. We're going to do the closing session, and the kids are going to do a short piece, and then I'm going to talk about it and how we work with them. But the piece is it's about this song. The song that's like 500 years old talks about Wolverine, and we're going to act that out, and then I'm going to talk about how we do peer education with our youth, and that we know from the literature that peer education works, and if we can get these young people to create a movement, be proud of who they are, be proud of being Native American, and know that what's important is for us to live those values, those 7 grandfather teachings that were given to us. If we can live those every day to the best of our ability, our youth won't have to use anything to change their mood to escape. Okay, I'm gonna let my dog in, then I'll take questions. Hold me down, Susan. Go ahead. Right now. You too. Okay.
All right. Thank you, Sharon. Miigwech. I'm going to see if there's any questions. If you want to, let's see. Daryl, are you still on here? Daryl Olson?
Yep, I'm still here.
Okay, so maybe if people want to unmute themselves to ask the question, or you can type it in the chat. But if they want to unmute, then I think, Daryl, you'll have to change that security thing.
Yes, I just changed it so everybody is open.
Okay. Do you have any thoughts or anything that you want to share with Sharon? Or questions?
As people are thinking, I just want to say Miigwech Sharon for sharing all of your work and like these ideas around what we can do and how we can connect with our community and we can really be there. But I have a question. So like here in St. Louis County, our St. Louis County, they have a data equity committee that reached out and they shared some information about they're looking at data and they were saying that when they were there's a national map for when people experience an overdose, and then law enforcement usually responds and then they enter some demographic information into this national map. And so St. Louis County and other counties can access that information to kind of see demographics or to see trends. So so some people on the committee reached out to me because they said that they were shocked by the number of Native women that were experiencing overdoses. And even though the rate was so high, there wasn't as many fatalities as other groups. And then they also said that there was the intervention, they collect like if anyone does an intervention to prevent that death. And usually it will be like law enforcement or like EMT. But for Native women, it was a family member, a friend, or a community member who did the intervention. And so in the work that you're doing, and you had talked about distribution of Narcan and having that on hand. Like, have you seen that? How have you seen that play out in the metro area?
Yeah, we do. We don't just give them the Narcan, we do training. And so the training can be like one-on-one with somebody. It can be on Zoom. It can be in groups. So our Narcan trainers will go to like community organizations and do training. And so people, can carry it with them. And, try to also tell people like, don't use by yourself, because if you do, if you're having an overdose, there's nobody there to help you. So yeah, so we've trained a lot of people, and in fact, in our We've Been Gay program, that's a youth commercial tobacco prevention program. We had a middle school, and one of the Native programs there asked if we could come and do Narcan training there. So that's sad. But yes, the teacher said, well, I don't know if the school will go along with it, but I need to have the training myself. And so we're waiting to see what the school says. But yeah, so I mean, it is such an issue that at first, we first started training people, that was like we were training the police, right, and the EMTs. But now we're just training, like I say, community groups, individuals.
Sharon, I have a question. This is Ivy. So can you kind of walk us through how do people get tested for HIV? Like, do you have do they just know to come to certain places where they can get tested, or how does that work?
So people can get tested any number of places. You can go to, you can get tested by your physician, when you have your annual physical. But you can also, um, go to clinics and request a test. At our office, the people call and make an appointment, and they come and get tested. And it's a simple finger prick, and the results fairly quickly. It's a rapid test, and it's about 90 some percent accurate. And if somebody does test positive in our office, then they'll do another test, a confirmatory test, to make sure. And then if they test positive, then we try to get them into a clinic right away. So it might be like a navigator person or a case manager will take them to a clinic, and then they can get their initial labs done and see. It depends on where you're at, what the virus load is like in your body, to determine what the next steps are, and that has to be done with the physician. Yeah, it's a quick test. I think we're just getting approval from the CDC to begin to think about going outstate again to do some testing. And a foundation just gave us some money for a small RV, and so we'll be ramping up to do that probably soon here. I think like sometimes on a like on the reservations, if I want to get tested at Bois Forte, well, my cousin is the head of the health department, and then another cousin is the public health nurse, and so sometimes those are things that people think about when they go to get tested for HIV, because of the stigma attached to it, but I'm not familiar enough with Duluth to know where people could go and get get tested. But I would guess, I know in Minneapolis, like we had the Red Door, in St. Paul, there's room 111. There are places where you can go, and it's, nobody's going to know you.
Okay, yeah, thank you. So I'm thinking like of people that are encampments and things like that, homeless encampments, and do they know that there is services, or that testing is available to them? And
when it's warm enough, when the temperatures are right, like we actually go to the encampments and do testing.
oh, okay.
Yeah, the test kits have to be kept between, you can't get under like a certain temperature, and they can't get too hot. So with the RV, we'll be able to control the temperature where they're stored and when we're doing tests. So we just got that. It's a used RV, but it's in pretty good shape. So really grateful for that. We can go do some more.
Yeah, that's nice.
And I see Sue put something in the chat
Yeah.
where drop-in testing.
No, that's great to know. I did not know that. So Thank you.
So this is Daryl. And Sharon, I have a question for you. And Sue, I don't mean to put you on the spot, but the numbers that were given about what has been reported in regards to positive cases. Sue, do you feel like what are you seeing here in St. Louis County? And Sharon, second, do you feel like those numbers that are reported are lower than what's really going on in our country, in our communities?
Yeah, for sure, because that the thing about it is that you know historically this has been true. By the time Native people generally get tested, they've been positive for a while. And we also know that, with the new medications, the sooner you start the medications, the easier it is to get your viral load to zero. So, but many times, people, especially people who are, you know, unsheltered, people who are, like getting a test for HIV isn't like that's not Zeus. That's not their the main thing they're thinking about. So I'm sure the numbers are probably higher than what gets reported.
So this is Sue. For whatever reason, I don't seem to be able to turn my camera on, but Sharon, I'm super happy you're here. And, for everybody that doesn't know, I wouldn't be able to do the work I do today without Sharon Day giving me an opportunity in 1996 as my fiscal sponsor. And my incarnation then was Women with a Point.
Yeah.
And so having said that, and really Miigwech Sharon, I am super nervous about what's going on up here. And like we cover a lot of territory, and Shayna that works with us is from Red Lake. And Delaney is from Leech Lake. I've got people up in Bois, Forte, everywhere down in Pine County, all around Duluth. And I can tell you that just from the whole standpoint of syringe shortage and the amount of sharing and things going on, all I can say is it is scary to me. I have done this work for 30 years and I understand how HIV is shared and how people become infected. And so I would say it's very scary and concerning. And I would say even more so, I was raised up here and I had no illusions about racism as a kid in the 60s and 70s, and everything about community meetings compounds that original experience as a kid. The impact of racism as a public health crisis up here is not to be underestimated. And I think the powers that be do not pay well. There's a reason why we have disparities the way that we do, and somebody sat and watched those numbers climb. So I don't know, that's my pitch for right now, and I'm open to any sort of conversation. But we offer testing, we offer mobile testing, we go where people are at. Shayna did a pop-up up at Red Lake, and we have a pop-up fish house. And so she did 6 tests outside in January. So we're here. We're responding.
There's something in the chat about people with unstable housing, homelessness, and more at risk. I think there's just that blurb on there, and I had that slide, and I don't know what I did with it. But if you do go to the health department, Minnesota Department of Health, there is a I just looked at it today, what the current numbers are, and they do talk about the unsheltered population and people being more at risk.
I
Also
see,
about-
I saw that. Oh, I'm sorry. I have a delay. I didn't mean to interrupt you.
That's okay. That's okay.
I did see where they listed them at greater risk. And I was going through a lot of the stats, and they have a lot of stats about other things, other factors on the one that's, oh, they have, I can't remember the name for it, but it's like the correlation one where they talk about people who are cisgendered or identifies male at birth, and then they have the race, the different race breakdowns, and the number, or the HIV going to AIDS within a year, and a whole bunch of stats. But I don't see any on sex trafficked persons. And I was just curious about, in northern St. Louis County here, we're seeing more homeless youth, and we're seeing more sex trafficked youth. I've been doing this for child protection work for 16 years, and I've never seen the numbers that we're seeing. And a lot of those kids are people of color, and they're people who are living in poverty, and who oftentimes even are bisexual or identify as LGBTQ, and they're being pushed out of their homes, and then they're to survive, they're being trafficked to just to get a place to sleep or food. And I just can't, I'm not finding those stats on particular to homeless individuals or sex trafficking. I do see where it's a risk factor,
Yeah.
but I don't see where the stats are broken down. But like you said, maybe the homelessness creates a lot of barriers for folks to even probably get tested, and enough to get stats on it maybe.
And it also just may be something that the health department isn't tracking. But they're also, we know, like, whenever you have like the encampments and when young people are pushed out of their homes or leave their homes, then and this has been going on for so long, then you have the predators. And one of the plays we did, Everything is a Circle, we talk, the kids talk about that a lot, about how to try to protect yourself and protect each other. And even when I was a kid, my grandmother used to say to us, when we go out, stay together, so. Okay, is there any other questions?
Hey, Sharon.
Yeah.
This is Sandy in St. Louis, Missouri.
Hi.
Hi. I wanted to first start with, I don't know if you're aware of how far the pebbles you drop in the water spread out, and even influencing this far south of you, that you have reached so many people in so many ways. And I just want to say, Wado Miigwech, all respect for you. And with that, I was in first grade teaching when you met me. And now I'm delivering food to some of our unhomed encampments and doing some medical navigating here, but we don't quite have the population, the native population, as Minneapolis, et cetera, in Missouri, or I should say in misery. Okay. One of the things that I wanted to try and foster here is getting more youth involvement. And we've got, it's like there's this crop of new children in our community, and trying to get them together and not pull, getting them to see they have a view of themselves is not the majority culture, that's not pulled by TV and all the electronics. And I'd love to do some theater things with them. So just letting you know that that's something that came from you. And number 2, I'm on the water in a kayak because of you, Miigwech. Third, something that I've noticed is that we seem to be crossing over, and the young ones that were, it seemed like it was like people in cocaine versus meth. And now we've got this switch over to meth here. It's become really cheap. And then you add in the statistic that we've gotten like nine times higher with our STDs since the pandemic. And I just like someone else mentioned, I'm just really scared. And I pray about it, but I'm also handing out Narcan. I'm also handing out, I need a better condom supply, but handing out condoms. And these are things that I never thought about until I met you. So I just wanted to say, Miigwech, Wado.
Sharon, this is Leanne again, and I just want to say thank you for coming tonight and really being here with us and sharing with our community. And thank you so much for all the work that you've done for so long and all the people that you have really touched and impacted. So, Miigwech.
Thank you for having me.
So just to close, we will be publishing this recording on our AICHO YouTube channel. So please share and watch for that, and we'll send links out as well. Ivy, do you want to talk a little bit about the survey that you send out?
Yes, so there's usually a survey that goes out, and so in an email to all the registrants. So expect an email with the survey link and the link to this recording. And please fill out that survey to give us some feedback, and we'll share that with Sharon as well. Yeah, so you should get that, and then probably tomorrow, that email.
Yes. And this is Daryl. Just a heads up, I will be the one sending the survey that was created after Ivy is able to download and record the YouTube video. And Miigwech, Sharon, really appreciate you being on this, and everyone else who joined.
Love me.
All right, is this it? Are we done here? All right, so
6 minutes early, guys.
yes. All right, Miigwech, Sharon, I'm gonna sign off here. Miigwech to everybody that joined.